My dog Asha had parathyroid surgery just over 5 weeks ago. If you'd like to hear the results of that surgery and whether I felt that it was worth it or not, please stick around. Asha, who is a border collie, actually had 2 parathyroid tumors. She had the tumors removed, and she just had her last ionized calcium blood test on Wednesday. The ionized calcium test is basically an indicator as to whether the parathyroid is working effectively. If you want to start at the beginning of Asha's parathyroid story, you'll see the link for the playlist right about here, or if that link doesn't show up for you, it will be in the description below. Here is the latest update to that story. In the last video, Asha had just had her surgery and had stayed 2 nights at the vet. Her ionized calcium was still on the low side and not within the normal range. She was taking calcitriol twice a day, as well as calcium carbonate, or actually a generic version of Tums, 3 times a day. Asha's sutures were removed 10 days after the surgery, and the incision ended up looking pretty good with no redness or swelling. Her ionized calcium levels were in the normal range on the supplementation, so her calcitriol was reduced to once a day, and the calcium carbonate was continually reduced as well. About 2 weeks later, she had another ionized calcium test, which also came out in the normal range. She then rotated by taking calcitriol one day and calcium carbonate the next for about a week. Then all supplementation was stopped for about 5 days, not quite a week. So her last appointment was July 17th, and her ionized calcium levels were completely in the normal range. The biopsies for Asha's parathyroid tumors were consistent with parathyroid adenomas, and apparently removal is considered curative. So the process of getting Asha's ionized calcium into the normal range took 5 weeks and 2 days. Asha had 2 parathyroid glands removed. I'm not sure that her situation is actually typical. I have a friend whose dog had 1 parathyroid tumor removed, and she didn't have nearly as much follow-up with the ionized calcium tests. Her dog was in the normal range fairly quickly. Right after the surgery, Asha was drinking an awful lot of water, actually more than before the surgery, but I have a hunch that that's related either to the stress of the surgery or some of the medication that she was on. She's drinking water totally normally now, not excessively at all, so that symptom has definitely been addressed. Asha's appetite had been pretty good throughout the whole process, but her symptom of throwing up after her morning breakfast is completely gone. She had another kind of odd symptom of licking at her dog bed, and I was going to say that that symptom seemed to have been gone, except this evening I actually saw her licking at her dog bed again. So I'm not sure if that's a comforting thing or a stress thing or just bringing out a certain smell. Asha was very close to my dog Sprite, who died over a year ago, and that bed was one that Sprite often slept on. So you never know exactly why these things happen. She seems pretty much herself now. Her lower back has been a little bit on the sore side, so I'm going to look into some therapies for that. She's an older dog, she's 13 now, so she's bound to have a few aches and pains. Her fur is slowly growing back. She still gets to wear her fancy scarf just to protect the incision a little bit, and because she looks a little funny shaved all in the front the way she is. But she can also wear her collar now. The incision has healed very well. So, was the surgery worth it? There was another consultation fee after Asha's surgery, as well as 4 additional ionized calcium tests. And that totaled for about $475, including tax. So the surgery, including the follow-up and the blood testing, came to a total of about $6,000. So definitely not a cheap surgery. And that doesn't include x-rays and blood testing from my local vet before the surgery happened. It's actually the most expensive surgery I've ever had done with a pet. So again, was it worth it? For me, yes, because Asha is still in good health and doesn't have any major underlying problems that we're aware of. She is an older dog and anything could happen, but things look pretty good for her right now. And honestly, having lost my dog Sprite just over a year ago to kidney failure, I was really grateful that there was treatment for Asha's condition. But having said all that, I still have a roof over my head and all that I need to keep me going. But I know for some people that this type of expensive surgery could be a very difficult option. I've had mixed feelings about pet insurance, but I do think for many people pet insurance could be a very good option if this particular procedure was covered, and you'd have to check into the individual insurance to know what exactly is covered. This year has honestly been pretty tough for me in terms of pet surgeries. I had mentioned in one of my other videos that Asha had dental surgery earlier this year, and also my puppy Skene has just had luxating patella surgery, and I also just found out that my cat needs dental surgery, which will be happening next month. In February of this year, I actually broke my own wrist, and my dad passed away in April, so it's been a pretty wild ride this year so far. But again, back to the costs. You know, there are people who buy fancy cars, travel a lot, buy expensive home furnishings, fancy houses. Having a pet can be an expensive undertaking, and it's something you have to honestly consider before getting a pet. They're dependent on us, and we do have to meet their basic needs. I don't have kids, but I understand they can be expensive too. So I guess my pets are just my expensive family. Asha is a really special little girl, and I'm looking forward to doing some fun videos with her and training in the future. But again, my puppy Skene has just undergone luxating patella surgery, and if you'd like to hear his story, that link is about here. If that link doesn't show up for you, just check in the description below. We love our pets and we try to do what's best for them. I hope you'll join us in our adventures. Here's to good health and many happy times with our pets.